Hi, welcome to the Twitch dry needling video training series, where I'll show you a fantastic dry needling technique followed by a manual therapy technique to get great results for your patients every time. Okay, pain over the eye. Very common complaint, and there's a couple of muscles that are actually connected by fascia, the galea, that's the frontalis and occipitalis. Those two highlight why it's very important to always look at the front and the back. Don't always look at the back of the neck, always look at the front, like we did before when we're looking at the cervical erector spinae, look at the sternocleidomastoid as well. In fact, incidentally, sternocleidomastoid will also refer to over the eye. But needling frontalis, we always follow that up with needling to occipitalis. Let's have a look at how we do that. So let's say the pain over the eye is in this area here, very safe in this spot, 0.22 needle, very flat palpation right in here, up right there. You can do your level 1 to 5, or you can do your level 6. Very easy. This is a high bleed area, so make sure that you add extra compression at the end so that if they do bleed, it's not going to bruise and cause them that discoloration is going to last for a long time. So no bleeding, that's all good. Okay, lie in your front for me. And I'll pop this underneath your tummy. Here for you. Perfect. Okay, now to prove that it is connected in the frontalis and occipitalis, all we're going to do is this. So to find occipitalis, which is going to be just below the superior nuchal line, so there's the top of your ears and there's the superior nuchal line all along there. Just below that, you should be able to find two little divots just in here, two little depressions right in here, and that is your occipitalis. Now if we get our model, after we put our fingers in here, to raise her eyebrows, just raise her eyebrows, there, you can feel that muscle right in here. It's actually, obviously it's not a muscle that you can, like your biceps where you bend your elbow and you can feel it. It's going to be connected through fascia. So raise your eyebrows again, and there, you can feel it in here. And usually they're going to tell you it's tender right in here. So let's say we're going to go for this one right in here, and of course it's in the hair, so you're going to be able to have to go through this hair and feel it right on the skull, and that might be a spot right here. You can go in a perpendicular direction, just hit skull, there we go, very superficial. You're not going to get any twitches here. That's one way of doing it. Or you could, if you find that there's this bigger area of tension in here, you're going to go along that muscle. So you're going to go along it like that. So you're going to insert it. Let's say that your area of tenderness was in here. You're going to insert here, go into that direction towards you, and then you can get a lot of great referral just from going along that fascia into here in that occipitalis. Of course, it's a very thin muscle. The only other precaution here, of course, is that because it's in the hair, that's if they've got hair, of course, unlike myself, but if they have, then if there's any bleeding, you might not see it. So make sure you add that extra compression, make sure they're not bleeding, so that you can make sure they don't bleed once you've gotten into another position. I hope that helps with treating patients who've got pain over the eye. Remember, treat the front and the back every time, just like we did with the front of the neck as well as the back of the neck. I hope that helps.